Hello, and welcome to this podcast on anxiety. We've all had good reasons to be anxious in our lives, but sometimes anxiety is more than just a normal response to a situation. Anxiety disorders are among the most common mental health disorders, affecting an estimated 15 to 20% of people at some point in our lives. In recent years, there has been a huge push to understand more about the underlying causes of these different disorders, and there are a few of them: generalized anxiety disorder, panic disorder, social anxiety disorder, phobias, and medication-induced anxiety disorders, to name just a few. Throughout this episode, I will go through each of these and discuss how to treat these different anxiety disorders effectively, what ties all these disorders together, where do they come from, what's the difference between feeling anxious and having an anxiety disorder, how do you know when to seek help, and what effective treatments do you have access to. Feelings of stress and worry are natural. They're healthy responses to daily life. In fact, in absence of these, when facing real-life obstacles, it's seen as abnormal. This type of stress or fear alone does not need to be treated per se, but just coped with. Everyday anxiety can be helpful to us. It is a response that helps us to prepare or react to difficult or dangerous situations, heightening our senses, which allows us to respond quickly. Unlike this everyday stress, clinical anxiety is a medical disorder defined by excessive feelings of worry or persistent, even intrusive thoughts about specific fears or a constant fear in general. The critical point here is that the aforementioned anxiety disorders continue to affect the person even when the threatening or difficult situation is not occurring, or an overwhelming reaction to a stimulus prevents them from living their normal lives. At this point, it is hindering your quality of life. In general, it makes up the three things that are needed for an anxiety disorder to be diagnosed. The anxiety is out of proportion to the situation, the anxiety persists after the removal of the stressor, and the anxiety impairs their ability to function normally. The symptoms of anxiety are both physical and emotional. It can affect pretty much any part of your system of your body. It usually shows itself in the forms of shaking, sweating, tension, change in heart rate, dry mouth, insomnia, etc. The emotional symptoms commonly include restlessness, an overwhelming sense of dread, the feeling of being on edge, poor concentration, and irritability. The physical and emotional symptoms can cause people to change their behaviours, resulting in people leaving their jobs or losing contacts with their friends and family. These behaviours can often worsen the symptoms, including worry and reducing self-esteem. So when should you seek help? In an ideal world, you would get support even when things are going great, so that you know what to do if things change, or you want to help other people, or even just to talk about how great everything is going. But clinically, the advice is at the point at which these problems are interfering with your life, when you cannot achieve the quality of life that you want, is the point to seek help. If you are listening to this and think that you need some support with your anxieties, know that you are not alone. There are 8 million people in the UK who are, as I speak, experiencing an anxiety disorder. And that's just the people that have managed to get a diagnosis. In 2020, 5.24 million people in the UK met the criteria to be diagnosed with just one anxiety disorder: mixed depression and anxiety disorder, which is the most common of all those disorders. I'm trying to convey to you that someone experiencing this is not alone. There are millions of people out there who are going through the same thing. Unfortunately, however, it does feel like you are alone. When I've spoken to people who are suffering from anxiety disorders, they often feel like this crippling burden is theirs, and theirs only to bear. Either nobody else understands what they're going through, or they feel like they do not want to put their problems onto other people. It's only natural to think these things when you're struggling. Still, it's so important to notice and catch ourselves when we start to tell ourselves these things. To make a conscious effort to reframe a thought that isn't helpful for you. In this example, if you feel like nobody understands you, that's fair enough. Many people don't understand mental health. But who have you talked to? Have you spoken to someone that is trained to understand? Have you talked to somebody with lived experience with what you are going through? The way of reframing a thought would be that you have not found anyone that understands you yet. I have spent much of my life surrounded by high-functioning individuals with anxiety. Unfortunately, these are the people that often fall through the cracks in our system. If you can function at work, maybe even excel at work, maintain relationships with your friends and family, but your mind is racing and you're overwhelmed, fatigued and burnt out, unfortunately, we tend to just try and keep pushing through. So let's say you're experiencing some stress or anxiety in specific scenarios. What could you do to help yourself? A common tool a psychologist will introduce to you is cognitive restructuring, which is a very fancy way of saying thought challenging. It consists of 3 steps. Step 1, identifying negative thoughts. When you have an anxiety, your body forces your brain to perceive situations as more dangerous or damaging than they are. This is called catastrophizing. This step attempts to get you to focus on that thought that came into your head as you became anxious. Step 2 is challenging those negative thoughts. This step involves evaluating your anxiety-provoking thoughts. This often is the step that most people struggle with. I found through my own experiences that having a list of the different cognitive distortions, a fancy way of saying the ways that your mind plays tricks on you when you're feeling anxious, helped me to identify the weak points in a thought. So here's the list I use. Feel free to pause the video and write them down if you'd like to. Here are 9 of the most common cognitive distortions. Black and white thinking. This is when you can't see the grey areas between black and white. For example, I've completely ruined my life and nothing will ever go well for me. Fortune telling. This is when we feel like we are 100% sure of future events. For example, there is no point trying, it won't ever work. Overgeneralizing. This sneaky thought takes one instance or example and generalizes it to an overall pattern. For example, if a student fails one exam, they think they will fail them all. Mind reading. This one is pretty self-explanatory. As much as we like to think we know what other people think, we don't. Unfortunately, we only tend to assume what other people think is negative. Disqualifying positives. Acknowledging positive experiences, but rejecting them instead of embracing them. For example, my boss gave me praise at work, but they were just being nice. Taking this even further is the mental filter. This is when you completely ignore all positives and solely focus on the negative. For example, you have one argument with your friend or partner, and now you view the whole relationship as completely lost, as you only associate them with that negative thought. Emotional reasoning. This is one of the most historically difficult ones to identify. It refers to the process of our thoughts and feelings often being taken as fact. It can be described as, I feel it, therefore it must be true. But just because we feel something doesn't actually make it true. The classic example is if you're feeling anxious about infidelity or cheating in a romantic relationship and concluding that they have already cheated. Should statements. These are the classic what I should have done, or what you could have done, or what you must do. When we hang on too tightly to these should statements, the result is we often feel guilty when we cannot live up to them. And finally, there's control fallacies. These are 2 beliefs. The first is that we have no control over our lives and that we are helpless victims of fate. The second is that we are entirely in control of our lives, giving us sole responsibility. In reality, there is always some degree of control in your life, but never total control. The third step in challenging your thoughts is replacing those negative thoughts with more realistic ones. I'm going to give you an example. So you're walking down a busy high street and you're feeling extremely anxious. You've managed to identify your negative thought is that everybody is judging me. Can you think of what cognitive distortion that could be from the list that I've just mentioned? I will probably say that mind reading fits this example best. So a more realistic thought could be that people are more likely to be getting on with their life than thinking about me. Initially, like most psychological exercises, it can be difficult to do this. You might find it pointless or tricky if your anxiety is high. Still, a lot of research has shown that if you give this exercise time and routinely do it when you're experiencing negative emotions, it can remap your thoughts, meaning that eventually your automatic thought will be that realistic one. This technique doesn't work though if your anxiety is justifiable. Another quick technique that you could use is systematic desensitization. Sorry again for the fancy words, but this means that breaking down something that you feel anxious about into smaller, more manageable steps. This technique allows you to overcome or challenge your fears gradually, and even if you cannot overcome them, their impact on your life is reduced. Let's use going to the gym as an example. It's a very common problem. A study in 2018 found that 76% of 4,000 participants state that they would not go to the gym as they felt too anxious. To overcome this, you could use the aforementioned systematic desensitization. You could work out that you are feeling too anxious to go to the gym and that's what's stopping you. You could then maybe watch videos of people in the gym, learn the routines and the form of the exercises that you would like to do in the gym, and then go to the gym but not work out. See what it's like there, see if you feel comfortable. Then eventually go to the gym and use an exercise that you feel comfortable in. Commonly this is just going on the treadmill, doing some walking or running until you feel more competent and comfortable in that area. And then eventually building it up until you can perform in the gym how you would like to. These techniques are shown to be most effective when you are not at a point of severe emotional distress. It is tough to change your perspective or even recognise other ways of looking at things when you are in a depressive episode or experiencing high levels of anxiety. This difference is often overlooked by individuals who have not experienced depression or anxiety. Individuals suffering from these mental health problems need different ways of combating those thoughts. Those methods are different from everybody who is experiencing normal sadness or anxiety. But here are the clinical routes offered, the guidance on self-help and alternative therapies. Cognitive behavioural therapies are some of the most effective treatments for anxiety. The version of cognitive behavioural therapy you receive would depend on your specific type of anxiety. Dialectical behavioural therapy is a highly effective form of CBT. During DBT, you will work on both accepting your anxiety while actively working to change it. It focuses on 4 main components: mindfulness, distress tolerance, interpersonal effectiveness, and emotional regulation. Acceptance and commitment therapy is another form of therapy that has been shown to be effective for various types of anxiety disorders. I will go through this one in the alternative therapies and kindness and compassion podcasts. Interpersonal therapy focuses on social roles and relationships. It is very suitable for individuals suffering from unresolved grief, conflicts with family or friends, work or social roles, and social anxiety disorders. Currently, the National Institute for Health and Care Excellence, or NICE, which is the board that approves all therapies in the UK, only recommends trying treatments based on cognitive behavioural therapies. This means that you can try and get more specific versions of CBT if there is one available and your psychologist believes it is appropriate, but alternative therapies are not available on the NHS. I will go in depth in the many different ways of utilising self-help in a future podcast, but here are a few quick ways to help mitigate your anxiety. Exercise regularly. Regular exercise, including aerobic, strength, and flexibility training, may help you combat stress and release tension. It also encourages your brain to release serotonin, commonly called the happiness hormone. Again, I will go over this in way more detail in the Exercise and Nutrition podcast. Avoiding caffeine is another really good way of reducing your anxiety. Drinking caffeine can make you feel more anxious. There's a little receptor in your brain called adenosine, and one of caffeine's main actions is to block this receptor. This increases your adrenaline, which in turn increases your heart rate, potentially inducing the feeling of anxiety. In America, a whole psychological disorder imaginatively named the caffeine-induced anxiety disorder is based on this issue. Avoiding smoking or drinking. The nicotine in smoking creates an immediate sense of relaxation, but is only a temporary relief. All it does is relieves that initial nicotine withdrawal symptoms that are simpler to anxiety, and it also prevents you from finding smoke-free ways to handle your stress and anxiety. Breathing exercises, mindfulness, and centering techniques are all potential beneficial tools to help you cope and feel more in control. However, mindfulness is not recommended for social anxiety. Keeping a diary or journaling. It might be helpful for you to keep note of what happens when you get anxious or have a panic attack. This could help you spot patterns in what triggers these experiences for you, or notice early signs that they're beginning to happen. You could also take note of what's going well. Living with anxiety can mean that you think a lot about things that worry you or are hard to do. It's important to be kind to yourself and notice that there are good things too. You can also try peer support groups. Peer support brings together people who have had similar experiences to support each other. Many people find it helps to share their ideas of how to stay well, connect with others, and feel less alone. Similarly to depression, anxiety can be caused by both your environment and your genetics. The therapies listed above will provide you with some insight into the best ways to reduce the impact of both of these on your life. Medications and other interventions also play their role in helping people manage their anxiety. There are so many ways that we can help to manage our anxiety. Things like building a routine, ensuring that you are actually doing some self-care activities, or even just thinking about doing one of these things. We often get caught up in all the different things that we could or maybe should be doing. It's easy to forget to take one thing at a time, to be compassionate to yourself and allow yourself time to make the changes, because they're not easy changes to make. I hope that you've enjoyed this episode. I'd like to thank you for your attention and your time. See you in the next podcast.